Senator
Well,
Hatch.
thank you, Mr. Chairman, and I appreciate you wanting to keep this going, both as a courtesy to the Secretary as well as members. I'm grateful that you scheduled today's hearing. Secretary Sebelius, thank you for taking the time to be here today. Now, this discussion is long overdue. Mr. Chairman, the President's budget was released on March 4th, 37 days ago. Now, typically, these hearings are scheduled within days after the release of the budget. Indeed, it is generally considered to be routine to have budget hearings immediately. Yet here we are now, more than a month later, finally sitting down to discuss the HHS provisions of the President's budget. Now, that type of lag time is disappointing, to say the least. That said, the delay in holding this hearing is not the only delay that I'm concerned about today. Madam Secretary, each time you have prepared before this committee, I've asked you to be prompt when responding to our communications, especially those dealing with the implementation of the Affordable Care Act. Yet numerous inquiries submitted to HHS by members of Congress have been ignored entirely. And we have yet to receive the answers to the questions submitted for the record after your last appearance before this committee on November 6th of last year. This committee takes its oversight responsibilities very seriously, and I hope that in the future we can see a more cooperative and responsive approach to these efforts. And Mr. Chairman, given how HHS has responded to our past attempts to exercise oversight, I think we may have to schedule another hearing with the Secretary in the near future. That might be the only way that our members will get answers to the questions they submit after this hearing. Now, Secretary Sebelius, process matters aside, I have some specific policy concerns that I hope you'll be able to address today. For example, according to the President's proposed budget, combined spending for Medicare and Medicaid is expected to exceed $11 trillion over the next decade. And to me, that's simply an astronomical number. And we're only talking about two separate federal programs. Entitlement spending has become a generational challenge that demands all of our attention. However, the administration appears all too willing to continue to ignore these problems. The proposed budget would save a meager $414 billion over the next decade, or roughly 3.7% of total Medicare and Medicaid spending. And it would do so primarily through provider cuts and government price controls. Anyone who spent more than 5 minutes looking at our budget has concluded that these programs are in serious trouble and that they are, along with Social Security, the main drivers of our debts and our deficits. The Nonpartisan Congressional Budget Office, for example, has referred to our health care entitlements as our, quote, fundamental fiscal challenge, unquote. And I hope that during today's hearings we can get some answers about entitlement reform, because it is, quite frankly, one of the elephants in the room when we're talking about our nation's fiscal future. Another elephant in the room is implementation of Obamacare. Last week, President Obama took to the Rose Garden to spike the football and declare his health care law a, quote, success, unquote, after it was announced that 7.1 million people had enrolled in the program. So far, the administration has spent at least $736 million on advertising for Obamacare. Some say more than that. The healthcare.gov website has cost more than $317 million. The call centers have cost at least another $300 million. So using the most conservative estimates, the total cost of the website and the advertising have to date amounted to just over $1.3 billion. That's with a B. That's a lot of taxpayer money, especially when you look at all the outstanding questions like how many of these people will actually pay premiums? How many of them already had health insurance before the law went into effect? So far, it appears that the administration is hoping that the public will ignore these important questions and only focus on the number of claimed enrollees. In fact, Madam Secretary, in your testimony before the House Energy and Commerce Committee in response to some of these very questions, you stated that members of Congress would have to go ask the insurance companies because you and your department, we're not keeping track of these figures, or at least that's how I interpreted it. Now, it is my understanding that the 7.1 million enrollees touted by the administration and much of the press is merely a count of those who have selected an insurance plan through the exchanges, not of those who have actually purchased and paid for insurance. Now, that seems like a pretty odd number to celebrate. Indeed, it's like Amazon.com taking stock of how many people have placed items in their shopping carts and then counting them as sales. In other words, it's a false metric. It is certainly not one that can justify the President's attempt to declare that the debate over his health care law is officially over. There are many other questions that need answered with regard to Obamacare. For example, so far the administration has made more than 20 unilateral changes to the law. What is the cumulative cost of all those changes? And while we're on the subject, how many more delays and changes are yet to come? And as you can see, there are a number of important matters to discuss today, but both with regard to the President's budget and the implementation of Obamacare. I just hope we can have a serious discussion about these critical issues. Madam Secretary, I do know that you have one of the most difficult jobs in Washington. I've worked with HHS all these years, and it's not an easy job. I appreciate you being here. And I know that you've been back and forth and sometimes not treated as well as maybe you should be. But we're grateful to have you here. Mr. Chairman, we're grateful that you're holding this hearing.